exactly will look like, I try to give you a glimpse of my understanding, of my perspective, and I'm very much looking forward to hear your feedback afterwards. Maybe to start with, you are in a very great setting because the cluster of Heidelberg and the entire region of Baden-Württemberg is super well connected. There's a very vibrant ecosystem now created and taking pace. And the fact that you have decided to join this this course and to join this talk series at least shows me that there is a great interest also from the academic and cluster community. So that's a great starting point. Raul already said I'm representing the Health Innovation Hub. That is a team of 12 experts. We have been set up only recently, saying March last year, and we will already dissolve ourselves in 15 months from now, end of next year. So this is only a project of the Federal Ministry of Health to have a number of experts at their site, which are neutral, which do not are not paid by pharma, medtech, or big corporates, but experts directly from various parts of the healthcare system to support the ministry, but also any other large national stakeholder in the healthcare system in the current transformation towards a more digital healthcare system. So this is basically the team. We have medical lawyers in the team. We have data scientists, guys like me from the startup and tech world, but also a pharmacist who still has 2 pharmacies in Germany, a physician who still is 1 day per week in his medical practice, a gentleman who was already digitizing German hospitals 10 years ago when no one else was talking about it. So really a broad spectrum of perspectives to make sure that whatever is regulated is actually implemented in the right way so that all the political efforts reach, in the end, the patient for a better healthcare system. We are targeting a couple of topics, basically anything that is currently discussed in terms of digitizing our healthcare system. I will touch a number of them today, but happy to reach out to me afterwards if you have questions to any of the other topics here. Now, I want to start with looking at the year we are in and a bit the environment. And usually if you are a German citizen, you have a very German perspective and focus, but I want to start my talk here with a bit the world around us that is pretty much changing and that is very much defining how our healthcare system is going to look like in the upcoming next years. So exactly 12 months ago, I did a bit research. I just screenshotted whenever one of the large tech companies was doing something specific in the healthcare sector, because all of them very much have healthcare as their major strategic field. So Google, for very long, it was unclear what they exactly wanted to do in healthcare, but they released about a year ago their strategy, and not too surprising maybe, they very much focus on search. So Google wants to be the tech partner who is the quickest and most efficient in finding the exact right healthcare information in your dataset and in any other dataset, so that the physician in medical practice is Googling what he needs to cure you in the best possible way. And they basically, on the same day or a few days before, acquired Fitbit, who used to be a smartwatch supplier, but they also very much turned also towards healthcare, and suddenly a lot of health data is now in the hands of Google. This just happened within a week. Amazon is probably even more aggressive in this field. First, they started to launch their own health insurance fund and acted as a health service provider for their own employees. Then they quickly found and partnered with other large corporates. So they are already in the States a health insurance fund basically, if you look at this definition from a German perspective. And then they acquired a large online pill supplier and a lot of know-how in this area. And what was striking most for me is if you look at this tiny example, because it's suddenly turning consumer electronics into the healthcare world. If you have an Alexa speaker at home or any smart speaker that can run on systems like Alexa, it may ask you in the near future, if you are based in the US, if you already took your medication. And if you don't know what pills you exactly should take, Alexa may know that, because in many states, they are already connected to the electronic health record of yours, and they are able to manage your prescription. So on the one hand, they may remind you every morning to take your medication, ask you if you did it, and may report it back, and they shall also know if you have enough medication at hand, because they may be also the ones who supply it to you. Luckily in Germany, this is not happening too soon because we have a lot of regulation at hand. But this is just an example of how the consumer tech world is jumping into the healthcare sector, which was for very long a gated environment. You need to have a white coat and a PhD in order to treat your patients. And suddenly this is somehow taken over, at least in some first pilots, by tech and especially consumer tech. Now, as you know, consumer tech is already at the brink of healthcare. You all probably know the smartwatch example of Apple, where you can take a EKG and check your cardiovascular activity. The example on the right is something that I am a bit guilty of, because this is one of the companies that I founded before I joined the Health Innovation Hub. That is a headphone, a consumer tech headphone, nothing specific about it, but based on, in combination with our software, it suddenly can take a hearing test that is as accurate as if you would go to an ENT doctor. So this is another example of how consumer tech is moving into healthcare based on software, and this at a rapid speed. And just so you know, it's not stopping with the hearing test here. Based on your individual hearing profile, this headphone can then adapt sound so that you hear it the best possible way you individually. Meaning, if you are not 20 anymore, but more towards your 40s or 50s, and you may have some mild hearing loss on the left ear, but not on the right, this headphone is automatically calibrating for that. Another example that I stumbled across in the past couple of months, especially around Corona, was Taito. Taito is a company based in Israel, and they are offering basically all the hardware a GP typically needs in his practice, and they offer this as a subscription service. It's a very smart combination of devices. You basically always have the screen on the left-hand side and can add on the various other hardware pieces, and you can rent it on a monthly basis. So this is empowering basically anyone who has some understanding of this topic to be, or at least to use those tools for first diagnosis. And Taito was one of the key players of the first wave in Israel when they suddenly had to set up a lot of basic hospitals in order to combat COVID-19, and they equipped every bed in a hotel with those devices, which are all smart. So they speak to one central cloud. So it was easier for the Israeli authorities to overlook the patients in this basic hospital, which used to be a hotel before. And I want to end our European American perspective with just outlining that a lot of new players are trying to enter the market. If you just remember what we saw here with the Taito example, and you have a large retailer who has real estate in basically every village in the States, they are very interested to be a new frontline in a kind of first line of healthcare, and that is something that at least we should have in mind also in Germany. And now I want to end this quick tour d'horizon with global examples here in China. These two cabins are as large probably as the photo cabins you may know in front of clubs and central stations. On the right-hand side, you enter the cabin. There's a lot of smart tech in there. You can lay your hand on the panel, and there's an eye tracker and the video camera who tracks your eyesight and your facial recognition. There's telemedicine in there, so you're directly connected to a doctor, and the doctor will take a first kind of basic exam, and with all the tech in there, he probably is able to give you a first indication of what may be wrong with you. And then you exit the cabin, go to the left, and the next cabin is handing you out directly the medicine you may need. And this is, of course, not something that we will see shortly in the Western world, but if you have a look at the developing countries, this is a basic infrastructure that could help tremendously in areas where you don't have any healthcare system basically on the ground. And this is just a starting point how China is going soon to also influence heavily how healthcare technology is embedded in our society. So going back to Germany, probably most of you are at least based or resident here. If you would just think about the examples I just mentioned and our healthcare system, what would you say? How digital is the German healthcare system at the moment? We don't have a easy way to interact here, but I want to show you this result. In 2018, we ranked lowest in Europe. Only Poland was worse digitized than the German healthcare system. So this was kind of the wake-up call in Germany in regards to digitization, realizing that we have really missed the train and we have very much to speed up our efforts in order to catch up. Estonia, Canada, Denmark is on top. That's probably of no surprise to many of you. The German healthcare system looked pretty much like that, paper-based. Even today in most hospitals, if you're not lucky enough to get to the University Hospital of Heidelberg or any other university hospital, many hospitals are still paper-based, and many medical practices also used to be until very recently. I want to, before I jump into the details, have one basic understanding why we are looking so much at digitization. Why does it count? Now, on the one hand, we have a lot of technologies nowadays accessible, which with a computing power that is unbelievable if you just go back 3, 4, 5 years. Because of cloud, it's accessible for anyone. And then you add the smartphone dimension and realize it's in the palm of every citizen. So the connection is no problem anymore. Access to data is no problem anymore. Interaction is possible with basically anyone in the world, and the combination of those two technologies are super powerful. And the digitization of medicine very much helps also the patient. He suddenly has all the relevant data in the palm of his hand. He understands much better than before what's going on. We also have to improve our healthcare system overall because we have a lot of demographic change and we need to get our healthcare professional more productive. And in the end, if you combine all those trends, we will soon be able to have a medicine that is more preventative, that is connected to everyone, and that is even able to be personalized. So in the end, digitization is probably very much improving our healthcare system overall. Now, if you look at the citizens of the European states, they are very much in favor of this entire development. Even in Germany used to, if you look at the media, you only see data privacy and data protection issues, but the overall population is very positive. So the question I often get asked is, why are we so much lagging behind? Why is the system so slow in adapting? And on the one hand, and that's the good news, it's a complex system, yes, but it is a system that, at least to my understanding, provides you as a patient with the highest degrees of freedom. Because in the German system, you can choose whatever doctor you want to go to, whichever hospital you choose, and even this in combination with any health insurance, which you can change annually. So it gives a lot of degrees of freedom to any patient. And this, of course, makes it quite complex. If you look at the States, you only have a few HMOs, so health management organizations. They are a health insurance fund, and at the same time, often they own a number of hospitals and GPs. So of course, this world is a bit more simple on that end, but it does not give you the degrees of freedom you have in Germany and in many other European states. And at the same time, the German healthcare system is not governed by the Federal Minister of Health himself completely, but it's very much relying on various entities, institutions of the self-administration. So in simple, the physicians, the hospitals, and the health insurance funds together form the self-administration, and they very much decide what happens in the system and what not. But on the positive side, because such a high proportion of the Germans are statutory health insured, more than 72 million, this is a massive consistent market. So once we are able to open up this system towards digital solutions, you can very much scale your solution, your product. I want to now jump into a few examples of digitization efforts that have happened or are about to happen in Germany, to give you a better understanding of what kind of healthcare system you may place your solution, implement your solution in the next 1 to 3 years. And I want to start with again, asking you, what do you think, how many Germans are willing to have an electronic patient record, something that is completely unknown so far in Germany, but that is soon to be implemented and offered to any statutory health insured citizen? And again, it's surprisingly high. It's nearly 50%. This is pre-corona. Only about 30% are against it. And they don't even know exactly how the electronic patient record will work. But this was just a basic survey trying to understand if the public opinion is really what very often is condensed in the media. And I would say it's not. If you combine the undecided and the yes, 70% are at least open or curious about this new opportunity. And this is very much in contrast to what you usually see in the media. What is this electronic patient record, in short, EPA? So it can be a number of things, but on the first hand, it's an infrastructure. For the first time ever, any physician will be connected with a central data infrastructure, which we call Telematik Infrastruktur, very German, very long word, TI abbreviated. But we will have this infrastructure, which was only built for the healthcare system in the past almost 15 years, connecting every practice, every hospital, every pharmacy, and soon, hopefully, also anyone who is active as a healthcare professional. So, for example, also elderly care and physiotherapist and many more, connect to make sure that all relevant health data is accessible for those healthcare professionals when needed. And we will jump into a number of examples now, but this is the basic change now happening. We are building an infrastructure to exchange data here. How is this EPA, this electronic patient record, set up? So first, and in contrast to many other similar electronic health records, it's patient-led. So the patient decides at first if he or she wants that. And if he or she does not want to have an EPA, it will never be established. But if you want an EPA, you go to your physician and ask your physician to set it up. And then you as a patient also decide which documents will be in there and who will have access. So you can define very precisely what is going to happen with which of your health data to make sure that you as a patient are in the driver's seat. Now, it will not be that, and EPA is something that will start 1st of January next year. So any statutory health insured citizen, again, 73 million, have then the right to get an EPA from their health insurance fund. It will not be that from day one onwards, suddenly 73 million Germans have such an EPA. But we are currently working very much on creating use cases so that the physicians would love you to have an electronic patient record because it should ease his, her work a lot. First, we want to have something like a cover letter called in German Notfalldatensatz. That's somehow equivalent to an international patient summary, where the physician sees directly on kind of one page who is that patient, what medication is he taking, what shall I look out for? Does he have allergies or whatever? What happened to him last in the system? And last but not least, who was the physician who was treating this individual last? So this would help tremendously, not only in emergency situations, but basically in any type of care situation to improve the diagnosis and therapy. We want to connect the various silos of hospitals and ambulatory care with, for example, very much incentivizing electronic discharge letters from the hospital to the GP. And definitely one of the benefits for healthcare professionals will be that you have a longitudinal laboratory overview of your patient, not just the one document, the one at the specific time that the patient is at your practice, but you can then look at his past couple of weeks, months, or even soon years. I don't want to go too much in details on the right-hand side, but it's very much made sure that all relevant national institutions of our healthcare system have their say and that the setup is in the most secure possible way. And as I said, we will only have success with the EPA if we not only take care of security, but also have use cases and a high usability. One of the next examples that we as a Health Innovation Hub have been very much involved with is the National Health Portal. And of course, you've all heard a lot about Dr. Google and if you see at search results, Google is definitely one of the key players now of the first as kind of the entry point into a healthcare system, because many patients, before they even go to a doctor, before they even call a doctor, they already consult Google. And that's something that we definitely have to take into consideration and work on so that we can make sure that if the patient is already on Google, he at least sees the right content. And this is not something specifically for German. This is happening around the world already since a couple of years, and that's just a given. In the healthcare system, there's often a reflex against it, saying Google should not be in this position and we should prevent patients from doing so, but they will not. They would, of course, continue to Google and they will continue to organize themselves if they feel that the healthcare system is not really working in their favor. And these are just two examples. The right-hand side is a example from the diabetics world, because patients started to build their own systems injecting insulin and tracking the insulin. There was a lot of pressure on not just the medtech to come up with solutions like that, but of course also on the physicians and the healthcare system to have a better way to treat them. Now, the health the national health portal, in German Nationales Gesundheitsportal, is live since a couple of weeks, and it basically tries to fulfill three purposes. First, it should have information that is neutral and reliable. If you go to Google and search for any disease and indication, you may find something that is neutral and reliable, but a lot of stuff is just coming from the pharma world or anyone else who has a specific interest in providing you this information. And we want to make sure that there is one source for neutral and reliable information. Second, and equally important, most of the information you find that is neutral and reliable is not intelligible. So it's very important to find a way how to translate the medical information into an easy language, to use a lot of graphics and videos to explain to anyone what this information means. And this is why we also are working on the multilingual part, so that basically anyone can access the information. And last but not least, we want to make sure that the same information that you find on Google, that you find on this portal, can be accessed by anyone else. So if in the future you have an electronic patient record and you don't understand specific terminologies because you're not a trained physician or scientist, there should be an easy connection to this national health portal to explain you in a few words what the medical terminology means. And it should also be easily integrated into any other digital health solutions to have one point of truth. This is how it looks like. As I said, it's a public beta, but it's a first starting point, and soon Google will also rank the information that is displayed here on the very top to make sure that whoever is using Google will find neutral information. Last but not least, something that especially I personally have been involved for a very long time now, actually since starting the Health Innovation Hub, and these are digital health applications called DiGA in short in Germany. Maybe again, question first to you to reflect, do you use any digital health applications already yourself on a daily basis, or at least regularly? How many are this going to be? 1, 2, 3. Basically, we have already millions of people who use digital health applications on a daily or at least regularly basis. I just depicted 3 examples from Germany here. Many of you may know Clue. That's one of the best performing cycle trackers developed in Berlin just 6 years ago. ADA, probably also very much known, very good tool for first anamnesis. And even my small hearing test is already used by more than 1.5 million people. So this is just to show that if you have a digital solution, scale is not a problem at all. In fact, we, as a small company with Mimi, aggregated more hearing test results in 3 years than the Harvard Med School in 40 years. And this is just to show the impact of digital solutions on the healthcare system. But to go back, nearly all of those digital health solutions until recently had no business case. So there was no way of making money with the product other than selling data or being venture capital backed. And many of the companies that are here are still just venture capital backed. So they are burning money every day because they don't have a business model until right now. And this is changing thanks to the so-called DVG fast track. That is a new law that came into place in November last year, defining a structured way for digital health solutions to get into the standard healthcare system. So if you fulfill a number of criteria, like you are already a certified, CE certified medical product of a low risk class, and you have the patient in the focus of your product, you may qualify for this so-called DVG fast track. BfArM, that is the German equivalent for FDA, has only 3 months to check your application. And after 3 months, you may be listed conditionally or permanently for the German healthcare system. So This is a way to bring digital health solutions into the healthcare systems. They can be now prescribed by any German physician to any of the 73 million statutory insured citizens. And this is also something that was unbelievable only like 2 years ago. They are fully funded, reimbursed by the health insurance funds. So what may this DiGA, this digital health applications look like? There are various use cases. You can have a DiGA for diagnosis, for monitoring, or for rehab, for guidance, support, or therapy. You can have a combination of all the 6 or just of 1 to 3 of them. And the first DiGA just hit the market yesterday, because yesterday BfArM approved the first 2 digital health applications that can now be prescribed by any physician to any German statutory insured citizen. One of the DiGA, Calmeda, is a tinnitus treatment, and Velibra is a mental health application. And these 2 are just the first 2 of probably 20 DiGA that will hit the market in the next couple of weeks. We expect that by the end of this year, we'll at least have 20 DiGA that can be prescribed by German physicians. And there are more than 70 more in the pipeline. So this is really a dramatic change, because now the patient has something in the palm of his hand that he can use on his couch at home on a daily basis to track his health condition, to better diagnose his health condition, to monitor it, to work on the rehabilitation, to have something that supports your therapy. And this is really prolonging the impact of the physician, not just to the time when you are sitting with the doctor in his practice, but from then on until you meet your physician the next time. Maybe just some outlook. This happened very recently, and there's a lot of international excitement actually about it. We just hosted a larger, we called it International DiGA Summit, so a larger online conference where we had more than 1,500 participants from 40 countries who all want to get their solutions now qualified for the German market. And this, of course, will bring a lot of innovation to our system. If you want to look deeper into this topic, we just published a book that will be out this week's Friday, covering basically every topic from how to get a digital health company started to how you can apply for this fast track, until how you should prepare for the price negotiation. It's in German, unfortunately, for now, but we're working on the English version in the near future. And last but not least, I want to very much encourage you to continue what you're just doing and to start digital health or digital medicine companies, because we are very much in a system battle at the moment. You may have heard that in China, there are amazing tech companies rising. They have a massive database, of course, because they have a massive customer base. And the technology is getting better and better. And basically everything is controlled or is accessible to the state. And on the contrary, in the United States, you have equally growing ecosystem, super large tech corporates like Amazon, Google, Apple going into those markets. And there, all the data is owned by a private company. And I want to very much fight for that. It's neither the state nor the private sector who owns your health data, but that it is yourself who decides who has access to which kind of healthcare data. And that's what we're trying to build at the moment in Europe, to have a European data space, and that there the decision is in the hand of the patient and only the patient what is happening with healthcare. So very strong encouragement to continue with what you're doing. And now I'm very much looking forward to your questions. And this is just a very short summary of what anyone always should do to stay healthy. Exercise, nutrition helps you probably the most if you don't have any preconditions.